We're so happy you could join us. I'm Sarah Wright with the Colorado Foundation for Universal Healthcare, and we are a 501c3 nonprofit. Our mission is simple, guaranteed, quality healthcare for all for life. And we are so glad you're here. We will have people joining us, but I'm going to go ahead and get started because our lives are full, especially for us activists and physicians and etc. State legislators, moms, dads, etc. So you're all muted except for the speakers, and we hope that they are not muted, but we will help them if they are, hopefully. And if you do have questions or comments, please put them into the chat. I don't know if we'll have time to answer all your questions tonight, but we will do our best to respond to them. So thank you. And I'm going to be honest, there's never been a more important time for the Colorado Foundation for Universal Healthcare to achieve its mission. We now have local Colorado data showing what countless studies have shown, that when you cover everyone, you can save money. That was pretty awesome. That was muted me. So a larger majority than ever before wants a just and fair healthcare system in place in Colorado that actually cares for we Coloradans. To those who contributed as you registered, thank you so much. I ask that everyone click on the link in the chat. It's couniversalhealth.org, and that you contribute. Click the donate button at the top right of our website. Any amount, especially when you make it monthly, will help inspire the coordinated, massive grassroots actions needed to win universal healthcare for our state. You'll hear tonight about a gold mine of a study. Yet since the study's release on September 1st, it's been strangely silent at the Capitol and in the media. With your help, activists can rise and insist that our leaders act on the data. Please do give something before tonight is over to fund us, the movement of the moment. So welcome again, you're in the right place. This is Imagine Healthcare That Cares for You, Colorado. I am so pleased to welcome a special guest tonight, State Representative Emily Sirota of House District 9. She sponsored, alongside State Rep Sonia Jaquez-Lewis and Senator Mike Foote, the Healthcare Cost Savings Act, which passed with bipartisan support in 2019. It's the bill that led to this groundbreaking healthcare study, and it wouldn't have passed without actions and testimony from so many of you. Thank you. After Representative Sirota, we'll hear from 3 Coloradans, 2 providers and 1 business owner, about what a single payer universal healthcare system would mean to them and the people they care about. Then, New York Times bestselling author and highly acclaimed journalist T.R. Reid will present some highlights from the study's findings. Most importantly, we'll share actions you can take to urge our Colorado legislators to refer onto the ballot the universal healthcare plan for Colorado, like the one the study shows, will cost the least while covering everyone with great healthcare. I want to thank volunteer Jamie Chugtai for helping me run tonight's tech, and photographer Daryl Frund for the photos in the slideshow, and so many more. Welcome, Representative Sirota. Thank you so much for being here.
Thank you so much, Sarah, and the Foundation for inviting me to join you this evening. It is an honor and a privilege to get to work with folks like you. And as Sarah said, it is because of your activism, your advocacy, that we were able to present House Bill 19-1176, the healthcare cost analysis bill, that we were able to get that bill done. 2019 was an extraordinary year for a host of legislation, this being one of them. It was actually one of my first bills that I ran, and it's an issue that as is near and dear to my heart, is yours too. That that we live in a country of such great wealth, um, and there is incredible healthcare available to some, not all. And that I think probably I, like you, believe that affordable, accessible, and quality healthcare should be a right of all Coloradans and everyone in this country. And it should be the job of our federal government to ensure that everyone is able to access and afford healthcare in this country. But we continue to see terrible inaction at the federal level. Even this president has not, has not taken the steps when it comes to universal health care that the need demands, and truly that the pandemic has laid bare. But and we see even modest steps forward, like allowing the federal government to negotiate prescription drug prices being held up by other Democratic senators. So we still have a long way to go at the federal level. We cannot wait, it is clear, for them to take action, which was our message to the legislature in 2019 for the need for this study, was to say, we know that we still have hundreds of thousands of Coloradans who are uninsured and underinsured, many unable to actually access the healthcare that they pay for insurance, but they can't afford to use that insurance. And so we said, let us do the research. Let us see, what does it look like if we examine different systems compared to the current system that currently does not provide affordable, accessible, quality care for all. And so we ran this bill to compare 3 different systems: the current system, a multi-payer system that is, private, a mix of private and public plans, similar to what we have, but that there would be a heavily regulated insurance market. And then the third option was a universal, publicly funded, privately delivered healthcare system. And you will have a presentation, I think, later in the evening, going through the results of that report. But what we did is we ran this bill to say, let's gather experts across the state, gather them together, let them find a non-biased entity to conduct this study. And that is what they did. They did a literature review to determine, what does the literature say about the shortcomings of our current system? Where are the gaps? And then what are the possibilities in terms of cost for for these options? And no big surprise, a universal single payer system saves costs and covers everyone. So, but the goal was to really provide some non-biased, and we think that the School of Public Health did a really excellent job. Working with very few resources, because resources were a challenge. We only had $100,000 a year to dedicate toward this project. It was difficult to actually access additional grant funding due to the COVID pandemic. The focus was elsewhere. But I think that the task force did an incredible job. The folks who attended were dedicated. They worked very hard, very transparently. And the School of Public Health put together an excellent report demonstrating sort of, in my opinion, where we as a state need to go. And I know you all want to know, well, what can we do to get there? And I understand your frustration that it feels like it has been quiet in front of the legislature and the governor. I think, for a mix of reasons, we're in the midst of a climate crisis. We are continuing to experience horrific air quality. We are still in the midst of a pandemic. And there are any number of things going on that I think those in the legislature and in the governor's office are trying to address at any one time. And so it just hasn't gotten the traction that you would hope for. So what I would recommend is ensuring that each of you go to your electeds and make it a point to show up at, everybody does town halls. Show up at those town halls and ask them, have you read the report? I mean, before you show up at the town hall, you can certainly contact those members and ask to talk with them, make sure that they have seen the report and share what you think is important from the report. But, ask them and ask folks to respond to this crisis that we have, where folks either still, even with the ACA, cannot access affordable health coverage. And if they have insurance, there are still many who are unable to use it, or it doesn't actually provide the coverage that they need. And so I think it's a matter of continuing to ask the questions and do it publicly.
Thank you, Representative Sirota. Really appreciate you being here. Apologize for the background noise. We had a question in the chat that a couple of the city council members in Nevada thought the study was partisan. And the question is, it sounds like we need to do more as when we do reach out to people, when we do publicize it, to make sure people know that this study is a result of a bipartisan bill.
Yeah, it definitely, it did ultimately have bipartisan support. And in fact, Senator Smallwood was one of the yes votes on the bill and served on the task force. And I'm not sure I've seen necessarily any public comments from him, but he did attend meetings and did provide his input. And there wasn't anything partisan about it. It was a study that came from one of our public universities by nonpartisan researchers, just doing a study and analyzing the data and doing the math for us.
And it's my understanding that part of what helped the bill pass with a bipartisan vote was making sure there was this range of paying providers up to 250% of Medicare reimbursement rate, so that you could pay providers really well and see what the data was with that. So that's an interesting piece for those of us who are sharing about the study.
Great point, Sarah.
Anything else to add in terms of just, we know, I certainly didn't mean to sound like a criticism that it's been quiet. Certainly there's enough on everyone's mind right now. It's just a question of how we can be consistent and persistent to get some serious action to come from this data. So if you have any other thoughts before.
Well, I don't want to pour cold water on the results of the report. I think just for larger context about sort of the political space, which I don't think that means that we should stop talking about it, we should stop discussing it, but just that while we were passing this bill, at the same time, Representative Roberts was working on the public option. And so in 2019, we passed a bill that did provide for a study for that and then in 2020 worked on, but then because of COVID, we didn't get to continue with that public option bill. Then in this past legislative session in 21, the Colorado option bill was run, and it really got pared down from where it started. And I think, the amount of money that the healthcare industry spent on that legislation was staggering. Even even expecting it to be a pitched battle. It was, I think it was really, really a difficult uphill climb, even for something like the Colorado option, which is of course much smaller in scope than what we are talking about here, a whole complete overhaul of our healthcare delivery system, or at least the way in which we pay for it.
Right.
So,
well, that's part of why we always think you might as well ask for the whole enchilada, because they'll fight you if you just want one chili. Thank you so much, Representative Sirota. We appreciate your passing this bill and being here tonight. And I have to move on because we have such a full agenda. We could talk to you all night, but thank you again for being here. Really appreciate it.
You're welcome. Thank you, everyone.
Yeah.
And please feel free to always reach out if you have questions, concerns.
Okay, thank you. So our next guest, Jason Rivera, I keep asking you to unmute because you're muted, is a family medicine resident at the University of Colorado. And he is passionate about universal health care and continues to advocate for a system that places patients' lives and health over profits. Welcome, Jason.
Thanks, Sarah, and thanks everyone for being here today. I'm very grateful to be able to talk. I just wanted to touch on a couple of things very quickly. So like she said, I'm a resident here in Denver, Colorado. I come from Florida, where insurance is a lot worse, unfortunately. But I wanted to say that from my personal experiences, I grew up in an impoverished community where we were either underinsured, where we had insurance, we just didn't use it, or uninsured altogether. So the simple solution when you grow up poor in America is don't get sick, because if you do, too bad. You're either going to go bankrupt or you're just not going to get the care that you need. The second point I'd like to make is, what does this takeaways from this study? We have plenty of data, an overwhelming amount, to show us the single payer system works more efficiently, saves us money, saves lives, saves headaches. So what will it do specifically for me in my practice? Well, first of all, it will allow me to spend more time with my patients and less time on phone calls navigating a very muddy system where I beg insurance companies to allow me to treat my patients the way I was taught in medical school. The second thing it'll do is, by removing those cost barriers and insurance barriers, patients will come in the office and receive the care that they need. Many times now, the people receiving care are those who can afford it, not necessarily those who need it. And the last thing it'll do is it allows us to prioritize health outcomes instead of profit. And that's one thing that our country has backwards right now, is our current healthcare system focuses on extracting as much profit as possible while delivering as least amount of healthcare as possible. So what will it do for Colorado passing this single payer bill? It'll save us money as a state. It'll create a healthier workforce. It'll reduce disparities. Those include socioeconomic disparities, racial disparities, gender disparities in our care delivery. And it'll allow us to focus on health maintenance rather than a bunch of sick people who need a lot more care than we can currently provide. So in summary, I am fully in support of single payer healthcare, and I intend to spend the rest of my career fighting for it until we get it in this country. Thank you for having me.
Thank you, Jason. Appreciate you being here. Our next guest, Kyle Leggett, MD, is a family physician with health politics experience. His expertise includes policy development and translation, the intersection of policy with state-based healthcare legislation, and innovative approaches to addressing healthcare reform. Welcome, Kyle.
Great, thank you all for having me. As was mentioned, I'm Kyle Leggett. I'm a practicing family physician in Lone Tree and Aurora. And I'm gonna tell you guys briefly about a patient of mine who's really stuck with me, Sarah, who I met during my second year of residency. And it was at the beginning of a clinic day when I scanned my schedule and I saw a new patient, a hospital follow-up for a 50-year-old woman who had newly diagnosed heart failure and pulmonary hypertension. And the more I read the chart, the more I felt my intestines kind of gather into a knot. She had never seen a doctor until this hospitalization, and now she had all of these newly diagnosed, uncontrolled chronic diseases. And later that morning, I met Sarah, and in walked this morbidly obese woman with a ruddy complexion. Her edematous feet were straining against the straps of her sandal. Her oxygen nasal cannula was askew, and she just had this look of utter defeat already across her face. And as any good junior resident physician does, I started the visit by agenda setting. And we adjusted her diuretic regimen, her heart failure medications, and I developed a plan for treating her depression, chronic pain, and I even rebandaged the blistered skin from her lower extremity edema. And this whirlwind of checklists later, there were still a lot of things we had to address. And I said, let's plan for a 2-week follow-up. And she visibly blanched and said that was impossible. And I come to find out that she lives over an hour away from my clinic and that there was nobody closer who took her insurance. And she can't afford to take the time off of work or pay the $20 copay to come see me in the office twice in the same month. And in that moment, I just went into autopilot. I finished the visit by utilizing my social worker and care manager, trying to minimize those barriers to her care. And she left, and I finished the rest of my clinic day without issue. But as I was driving home that night and the adrenaline from a rapid clinic day wore off, I found myself really ruminating on her case. At that point, I was already struggling with burnout and moral injury. And I came to this realization that my 4 years of college, 4 years of medical school, and at that point, 2 years of residency training hadn't actually given me the tools to help Sarah. I felt equipped to deal with her medical diagnoses, but I felt helpless to change the underlying problems that were actually causing her health issues. And that sense of helplessness, more than anything else, really weighed on my shoulders. And there were brief moments when I considered stopping medicine altogether. And just a few short weeks later, I vividly remember speaking to Sarah on the phone, listening to her try to catch her breath between words. Clearly, she was struggling to breathe and likely in a heart failure exacerbation. And I begged her on the phone to come into the office or go to the emergency room. But through dyspneic breaths, she refused, saying that she needed to spend the remaining money that month to pay rent and not come see a doctor. And about a week later, she was hospitalized with a severe heart failure exacerbation, and after which she had to take a medical leave of absence from work, and she lost her home. The ironic thing is Sarah worked for a health insurance company and had their insurance. And it was these instances of trying to suboptimally manage these medically complex patients with phone calls instead of office visits and these preventable hospitalizations that caused me to look for solutions to the underlying problems. And I truly believe that a single payer healthcare system like the one described in this report is that solution. It would mean that patients like Sarah can have equitable access to affordable health insurance that they can actually use. It would mean prevention instead of reactionary care. And it would mean early treatment and management of illnesses before they become crises. And finally, it would mean a reduction in the learned helplessness that drives burnout for thousands of healthcare providers across Colorado. So I urge you all to use this report and use your voices to help transform healthcare in Colorado and ensure we have a better future for our patients and our providers. So thank you all for having me, and I hope this changes things.
Thank you so much, Kyle. Really appreciate you sharing your story and being here in your work, helping people as best you can with the system's limitations that we intend to fix. So Dr. Robert Davis is our next speaker, and he's the executive director of Unboxed, a nonprofit organization that provides executive coaching and leadership training to help organizations create strong workplace relationship cultures. He also serves as project coordinator on the Denver Task Force to reimagine policing and public safety, and on our foundation board of directors. He's a family life specialist with more than 20 years experience as a senior pastor, family life coordinator, and hospice chaplain and bereavement coordinator. Welcome, Robert. We're so glad to have you here.
Thank you so very much. Just listening to Dr. Leggett just pained my heart. I'm sorry. I didn't mean, it's not in my notes, but that just resonated with me. In the next couple of minutes, I want to share how healthcare impacts me in two very different, distinct, and profound ways. First, my wife and I are small business owners. I left my full-time job in 2019, and she left hers a few months ago. My insurance was through my employment as a pastor. By all standards, we had what would be called the Cadillac plan. When I left pastoring, we went to my wife's insurance, which was with the Denver Public School. The copay was so high and the deductibles so outrageous that we never actually used our insurance. Universal health care is a must if we're going to save new entrepreneurs like my wife and myself. Secondly, my great great grandfather's name was Joseph Davis. He was born a slave. And I'm not going to go into America's long history of racism, segregation, and abuse. Suffice to say, universal health care does not erase the long, dark history, nor does it solve the malignant cancer of racism that lives in the body of our nation. However, it is a significant step towards closing the racial gap and moving us towards a more perfect union. This is why I support the report. This is why I support universal health care. Thank you very much.
Thank you, Robert. We so appreciate you being here and serving on our board and all the other good work that you do in the community. Thank you. So T.R. Reed served on the Healthcare Cost Savings Act Task Force, is a member of our board, and chairs the board of the Colorado Coalition for the Homeless. He's also a New York Times bestselling author and has reported from 46 countries on 5 continents for the Washington Post, NPR, PBS, and National Geographic. He has a knack for making complex subjects like healthcare reform and the US tax system in his most recent book compelling and easy to understand. Tom?
Hi, thanks, Sarah. Hi, everybody. I twist Sarah's arm to make her say all those nice things about me. Very kind of her. Yeah, I'm delighted to be here. It was really good to hear Representative Emily Sirota, who was the sponsor of the bill that created the task force. And as she said, I noticed she said that the sort of watered down public option bill that the legislature passed earlier this year is kind of tiny in scope. It's much smaller in scope than what the task force experts have recommended. As she said, this task force was created by the legislature. The members were appointed by the governor and by both parties in the state legislature. It was bipartisan. We didn't have anybody from the insurance industry or the hospital industry on this task force, which kind of sets it apart from other special committees that study healthcare, because quite often the industry dominates other study groups, and that didn't happen with this task force. And the membership of the task force was 83% female, which makes a lot of sense in this context because women, it turns out, use the healthcare system much more frequently than men do. And therefore, they're the users. They're the people who can help us figure out what we ought to do. The task force hired, we were instructed by the legislation to hire some experts to look into healthcare in Colorado. We hired an excellent group of people from the Colorado School of Public Health. It was led by Professor Beth McManus, and then Professor Gregory Tung did a lot of the work. And as Emily said, I don't know if you've read this report, it's a 91-page report, but it's admirable. They really did a careful study. And let me just tell you, here's the key thing they found. The key finding of the experts was as follows. The state of Colorado could provide health care for everybody and thus improve population health, expand unemployment, reduce medical bankruptcies, and yet spend hundreds of millions or perhaps billions of dollars less each year on health care. Excuse me. Let me emphasize that. We could solve a big problem and spend billions less than we're spending now. I'd like to think that the legislature will be delighted when they get this report, because usually when these blue ribbon commissions study some problem in the state, they come up with a conclusion, yeah, we could fix that, we could fix that. We just need 20 billion next year in new authorization, and the legislature never has that. This task force reported that we could solve a major problem in Colorado and save billions of dollars from the get-go. I hope that the legislature will act on that. And of course, starting in January, that's going to be our job to see to it that the legislature does take this report seriously. Now, how did they reach that conclusion that we could cover everybody, improve healthcare, and save billions of dollars? Well, I'll just go through the steps they took. They started with our current healthcare system, as Representative Sirota and the doctors described it. Actually, Colorado is a pretty healthy state, according to the Commonwealth Fund, which does these comparative studies. They rate us as the 6th healthiest state in the country. They rated Hawaii #1. I guess if you hang out on beaches all day, you're healthy, I guess is what they're saying. We were certainly the healthiest of all the Rocky Mountain states. In some areas, Colorado is the healthiest state in the country. As you saw, just again, it was reported today, we have the lowest rate of obesity of any of the 50 states. And I don't think that's really not because of pudgy old guys like me. It's because we keep importing all these youthful skiers and mountain climbers with slender physiques. And I think they keep our average obesity down. But anyway, we'll take it. So we're a pretty healthy state. And we have some excellent hospitals. They're expensive, but we have excellent hospitals. And millions of people in Colorado get great care in fine hospitals. That's the state of the fact. But then, as Emily Sirota just pointed out, there are also hundreds of thousands of Coloradans who don't get the benefit of this. About 357,000 Coloradans have no health insurance at all. For them, their doctor's office is the emergency room, which provides no continuity of care and is an extremely expensive way to provide health care. And then there are probably twice as many, 700,000, who are what we would call underinsured, like Dr. Davis and his wife were. You have insurance, you pay the premium every month, but the copays and the deductibles are so high, you can't afford to go to the doctor. This is like Dr. Leggett's patient who couldn't come back twice in the same month because the copay was too high. And I like the term Dr. Leggett used. What this leads to, if people have insurance they can't use, it leads to preventable hospitalizations. Somebody has a mild illness, if we could treat it quickly, it would be fairly simple and inexpensive to care for. But in fact, because they can't go to the doctor, because the copay is too high or the deductible is too high, they sit around with this illness until they're in the ER facing tens of thousands of dollars of care. That's a preventable hospitalization. Anyway, this is the state in Colorado. Lots of people getting fine care and hundreds of thousands, maybe a million, who really can't get access to the care that our state could provide. And so then they decided, they concluded, therefore, that it would be better, both medically and financially for our state, if everybody had health insurance. Let me just read you some of the things that our experts concluded would result from from providing health care for everybody. They say universal care coverage for everybody in Colorado would improve overall health as well as chronic health condition management. It could lead to increased employment and increased worker productivity. Colorado would likely experience an increase in overall employment. It would likely decrease medical financial hardships and would decrease medical bankruptcies because now people would get paid, would be able to pay because they'd have health insurance. So those are the benefits of universal coverage. So then they questioned, how can we provide health care for everybody? And as Emily Sirota just told us, the legislature told them to study 3 different approaches. One is our current system, which I just described, with hundreds of thousands of people without any insurance. The second one they looked at is kind of a mixed system where some people get health insurance through private insurers, either through their employer or by going on a market like the Connect for Colorado Exchange and buying an individual plan. There are many of them on the market in Colorado. And then people who for some reason can't get that care or can't afford that care would then be covered by a public system to make up the gap, basically a gap filling public system. That's called a mixed system because it's partly private insurance and partly public. And then, so that's one of the systems they looked at. And the other system they looked at was a system in which everybody is covered by the same single payer system paid for by the state. In both of these two universal coverage models, the system only covers people up to age 65, and then you go on Medicare or stay on the VA if you're in the VA system. So how would those two work? Well, both of them would cover everybody and give us the benefits I just mentioned. The mixed system, they said, had two issues. One, it would cost a little bit more than what we're spending now for healthcare. And two, it would be hard to administer. It would be difficult for hospitals and doctors and chiropractors because there'd be so many different payment systems they had to deal with, and difficult for both the private and the public system to work together. So it would be hard to work with and cost a little bit more. Then finally, they looked at the government-run single insurance plan, where a government plan covers everybody, but people still go to private doctors, private hospitals, chiropractors, labs, PTs, etc. The providers would be the same as we have today. The payment system under this would be a public single-payer insurance system. And guess what? They found that system would cover everybody, improve overall health, and cost less. It would cost less. It would save hundreds of billions at the highest level of compensation. And if that single payer system used its negotiating clout to get hospital and doctor costs down, it would save billions of dollars a year. We'd cover everybody, we'd have better health outcomes and save billions of dollars. So that's pretty good news. As I say, this says, here's a problem a big problem we face. We could solve it and save money. Now, that report saying that, it came from these, as Emily said, these nonpartisan experts at the School of Public Health. That went to the legislature on September 1st, and the legislature comes back into session in January, and our hope is that the health committees in both the House and the Senate will have hearings and we can talk about this. But I'll tell you my fear. My concern is that they're just going to stick this 91-page report on the shelf with all the other government reports they get every year, and it'll be forgotten. And I think that's the strategy, frankly, of the health insurance companies and the hospital industry. They want to just push to the background and have nobody realize that if we took this step, we could save billions of dollars and provide better health care for everybody in Colorado. And therefore, I think it's incumbent on us. This is my argument, and it's exactly what Emily Sirota just said to us, and the doctors we just heard from. We've got to make some noise about this. We've got to let people know that there's a way to solve this problem and save billions if the legislature is willing to act on it. Emily Sirota told us that the spending by the health insurance industry and the hospital industry against the Colorado Public Option Plan was staggering. Hey, guess what? Against this plan, it's also going to be staggering. The insurers are not going to like this. The hospitals are not going to like this because this government plan would have negotiating clout to bring their prices down. I think doctors will like it. For one thing, the experts propose that many doctors would be paid a higher rate relative to Medicare payment than they are now. So I think doctors would like it because, as we heard tonight, doctors like it when their patients have insurance and can come in and get the treatment they need and can pay the bill and can come back for the second visit in a month if they have insurance. So I think the medical profession is going to like it. I think the health insurance industry, pharma, and the hospitals are going to fight it. So there's our job. Let's keep the legislature's toes to the fire here, feet to the fire, make them act on this report that says we could solve a problem and save billions of dollars for the people of Colorado. Thank you.
Thank you so much, Tom. We really, really appreciate you giving us a summary of that. And there is, especially talking about the actions needed, that was inspiring, because it will take a loud clamor of many individuals across Colorado raising our voices to basically make such a loud noise about this that cannot be ignored. So I'm going to walk you through some action steps, of course, as I mentioned before. Thank you to those people who have supported our work through the years and who supported it by donating when you registered. Anyone on tonight's call who can afford to at all, go to co universalhealth.org. It's in the chat among some great comments, and click on the donate button. And I'm actually going to take you, and if you give any amount, even especially monthly, it will support our work. So I'm going to go ahead and share my screen right now to take you to not all this stuff, but this stuff. No, not that stuff. Hold on. It's up, it's up, it's up. It's not up anymore. Okay, sorry. We had some people who were having trouble getting on and we had to send them the right links. So this is our main website, co universalhealth.org. And up there is the donate button, and that's where you donate. That's great. And then this banner right here, the light blue banner, will take you to an entire page of actions. So right here are ways you can help. Tell them to act on the data. And I'm not going to click on all these links. You can do that. We appreciate you doing that. But I just want to point out this petition is cool because it's being hosted by the Push to Pass Coalition. It's a group of various organizations in Colorado that are working together to win improved Medicare for all nationally and a Colorado universal healthcare system for our state. We'll take whichever comes first. And it actually asks the legislature to refer a measure onto the ballot to create a single payer universal not-for-profit healthcare payment system like the one in the study. And we're also urging our US Congress folk to pass improved and expanded Medicare for all now. So signing that petition, spreading the petition would be tremendous. We would love to have 1 million people sign it as soon as possible. Then, like I said, I'm not going to click on every link, but you can. We have language for you to email and call your Colorado legislators and Governor Polis and want to tell them. We have some good letters to the editor samples. We also have just information about letters to the editor and how to find the information from the publications. We will have upcoming events, but right now, if you click on this, it'll bring you to this event and you'll end up in some weird time loop. This is the most important thing. To spread the word, they're all really important. This is another very important thing, is to spread the word on social media. So Patricia, who's our social media director extraordinaire, will continue to post graphics on Facebook and Twitter with bits and pieces of the highlights of the study, like some of what we shared with you tonight. Please like our page, invite your friends to like our Facebook page. Please retweet our tweets. And then, also do write your own blogs and letters to the editor and post on social media about the study. And here's how you find everything you'll want to look at it for those of you who haven't already done this. So here's our media release about it, which gives you a good overview. And then there's the 7-page summary by the Healthcare Cost Savings Act Task Force. This is a really great way to get some really good bullets for social media or letter to the editors, just in the 7-page report. It's excellent. And then this is the 91-page report. to read through. And then we will continue to have events and actions and send you all emails. But anything you can do about these things is really important. And with your help, activists from across the state will insist that our leaders act on the data. And please do contribute something tonight to fund this, the movement of the moment, at couniversalhealth.org. And we really appreciate our speakers and our attendees for being here tonight. And what I'd like to do now is make sure that Bill is unmuted, wherever he is. I don't actually see Bill. There he is. Hi, Bill. Were there any questions? I haven't obviously been able to keep my head in the chat.
There was a question about whether Governor Polis is supportive of this. And I think the answer to that is we haven't heard yet. But he has often said that he wants to be bold on healthcare. And I think having guaranteed quality healthcare for all for life here in our state of Colorado, that would be bold. So I think it would fit with what he wants to do. It may be that he'll need to hear some encouragement from the people of Colorado to get him to be there.
Yes, candidate Jared Polis attended our 2018 Universal Healthcare conference, and I was trying to find real quick some of the pictures of him with our activists. But he definitely has said he's for universal healthcare, and as several people pointed out, this study, the task force work, was able to continue in a time when the state budget was pummeled by COVID. And many of us like to hope that Governor Polis and others intended this study and the task force and the bill to be able to complete its work, or that wouldn't have happened. But I think he'd be glad to lead a parade that was already in motion. So that's our job.
There's another more of a comment than a question, and a comment that I 100% agree with, that speaks to the equity that a single publicly funded, privately delivered way of paying for healthcare would give us. Healthcare is 1/5 of our economy, and it's one of the ways in which we drive racial and economic inequity in our country. It's one of the major ways, and one of the major ways to address it is to follow the lead that in the direction that this study is showing us, and get to a single system that we're all covered for. No matter your race, your creed, your employment status, marital status, whatever, you would be covered. And that would be a great step that we'd have to get us to a country that we want to live in, that we started off saying that we're all created equal to pursue life and liberty and to enjoy happiness. And so this goes to the heart of what we want to be as a country.
By the way, this is Bill Simple. He's our board chair, and I'm Sarah Wright, and we're both with the foundation. I'm sorry, I didn't introduce you yet, Bill. He's also an avid camper and often attends random places across Colorado with questionable Wi-Fi. Jerry Vermont asked the question, if we pass universal healthcare in the state, how will that translate to being sick outside of the state? So one thing to point out is that this, as Bill was doing a great job of earlier today, this study was really to compare apples to apples. And so it looked at lots of things in a single payer system in general, but it's not actually a bill. It's not a plan for universal healthcare in Colorado. We actually have a draft of another bill for universal healthcare in Colorado that will be being vetted by various experts and stakeholders, that could eventually become, possibly with a sponsor, a bill in our legislature soon. That is our hope. and then also could be referred onto the ballot if 2/3 of the legislature were to vote to do so. So we have our work cut out for us, but all the specifics of the bill itself will be determined when we have an actual legislation for a universal healthcare plan for Colorado. And we expect the savings will actually be much higher. Walt, I have the same exact Bernie image on the office of my wall. Oh, except in mine, he's holding baby Yoda. All right, anything else we should address? Bill,
Well, there's the other question about what will happen to the rest of the economy if 20% of the economy financially implodes. Actually, the opposite would happen. If people are not being driven into bankruptcy or financial poverty because of just getting the healthcare that they need, then they'll be able to pay the rent, buy the groceries. They'll be healthier, more likely to able to stay in their job. It actually will have a very positive effect on the economy. Our economy internationally, a car in the US costs over $1,000 more because of the healthcare costs that the car companies have to give to their employees. We'll be much more vital economically, as well as just being a lot healthier if we have a single system.
well said. And Kathy Blake asked if now is a good time to push for a bill, because the legislators are examining bills now and they're not yet drinking from the fire hose of the active legislative session. And the question is yes, and to Walter Carpenter's point, the challenge is now to get Coloradans behind the bill. So we have so much work to do. And honestly, would we need a waiver from the feds to do this? Yes, Rocana has excellent state-based universal health care bill that's out there to allow states to do this kind of thing. We're obviously 100% in support of that. So we have so much work to do. And, I wanted to say urgent this and urgent that when I was asking for money tonight. And then I got, I just thought everything's urgent. Our planet is on fire and everything's urgent, and we're being sort of knee-jerked around all the time by crises after crises, and I don't want to do that to you guys. What I will say is that I don't know who else could do the work like this and build the partnerships to pass the bill for Colorado, that this is the group that has been working on legislation that was involved in the first Colorado Care, that has been collecting data about how to improve on that, who helped with. And I'm not saying we did this by ourselves. We have partner organizations that we couldn't have done it without. We have activists we couldn't have done it without. But we did help, craft the legislation for the Healthcare Cost Savings Act, and host the lobby day for that bill. It was our legislative volunteers and activists, leading testimony that got that bill passed to get this study done. So we really are doing really important work on the front of universal health care for Colorado that I don't think is being duplicated by any other organization. So we know you're being asked and everything is urgent, but if you can contribute to us at couniversalhealth.org, any amount monthly will help this. We just have so much work to do, and then take those actions and then make more suggestions about other actions, and let's just keep going, and we'll keep you posted on future events. Anything else? It looks like there's some really good discussion in the chat. We are at 7:26. Do we want to address anything else right now? We can also look at how to address we are looking at, this is one thing I should let you all know, we're looking at the possibility of a wonky wonk event on this report. We don't know how many people would be interested in having like Greg Tung from the Colorado School of Public Health, like be able to answer all the questions and dig deep into the methodology and just have like a complete wonked out party on this bill. Shoot us an email or let us know in some way if you would be interested in our in-depth dive to this report. We're not sure it serves the overall cause for everyone to be have to do that. So just let us know if that's of interest. Anything else, Bill, that we?
Well, there was a comment about doctors getting reimbursed at whatever percentage of Medicare rates.
Yeah.
And there are several aspects to that. Their overhead would go down significantly if they don't have to have all the billing support. So they wouldn't need as much as the high levels of reimbursement that they get from insurance companies now, because their overhead would be less. But maybe even more importantly, they would be spent with one simple, relatively much simpler system. They'd be spending much less time doing data entry and filing for prior authorizations and filing appeals to claim denials. So they'd be spending much less time in all that noise that happens in their lives, and have much more ability to just pay attention to the patient that's sitting in front of them and being able to give the good quality healthcare that they're trained to do. And in addition, they would not be experiencing the level of moral injury that providers are experiencing these days, because providers know that a good percentage of the people that they treat are going to be driven into poverty, getting the good care that they're trying to give them. And that's a terrible place to have our providers be, knowing that you're driving people into poverty that you're caring for. We wouldn't do that to our kids. We wouldn't do that to our friends, but that's what we ask our providers to do these days. And so there'd be a tremendous reorientation to how healthcare is experienced in this country and in our state.
Amen. Well, I look forward to us one day having in-person events again, because I really miss the opportunity for us to all have a chance to talk with each other. We may want to do breakout rooms at our next event so we have a little bit of conversation together. If I unmuted everybody, it would be the clamor we need, but not quite the way we need it. So
this is what the majority of people want. So let's have a politics that gets what the majority wants.
yeah, amen. Jamie, will you unspotlight Bill and I? Because I kind of just want to see everyone's faces as they're saying.
Yeah.
And thank you again, Jamie, for your help.
Hmm.
I seem to still be spotlighted. Bill's still. We're working on the tech. Oh, thanks, Jerry. Okay, well, maybe I just need to say view gallery. There we go. Now you can see people. All right, well, appreciate everyone who made an effort to be here. And it's nice to see so many long-term fighters in this cause still fighting. Okay. Thank you. We're going to say good night. Thanks,
Good night, everyone. Thank you.
Bye.